Welcome back to Inside South Florida. May is National Stroke Awareness Month, and here to get you more aware about what you can do to prevent and treat a stroke is Dr. Ritesh Kaushal. Dr. Kaushal, welcome to the show. Good to have you here.
Well, thank you for having me over. Thanks.
All right, so May is National Stroke Awareness Month. My first question to you is, do you find do you think people by and large know a lot about stroke or not enough about stroke? Are you ever surprised by how little or how much they might know?
Unfortunately, that is the truth. I mean, 91% of all people absolutely have no idea about stroke. Most of them have never heard of something called as a TIA or a mini stroke. A TIA or a mini stroke actually is a forewarning for a bigger stroke to happen. And so really speaking, the education is getting better, but we still have majority of people who've never heard of a stroke.
All right, so let's get right into what you just said, the mini stroke, the warning.
Right.
Because immediately I started thinking, well, what is that?
Right.
So what is that? What happens in that case?
A mini stroke is where you do not really have any permanent damage to the brain, and that's the exact time when you want to catch the stroke to prevent a bigger one from happening. So what typical signs and symptoms of a mini stroke could be just some weakness, some numbness on one side of the body, some difficulty speaking. Usually these symptoms last for only about an hour or so and then completely resolve. But then these are forewarnings that there's a bigger event that's going to happen in the next 30 days or so.
You said to me before we started that this happens to young people too, and that blew me away. I had no idea. I always thought of stroke as something that happened to older people, but not the case.
No, unfortunately, this is something which is not known enough about, and a lot of times it's shrugged off. I mean, I had a patient who was 18 years old, and he came with a massive stroke. But he really thought that he was just not being able to move that side just because he slept wrong. And so he just tried to shrug it off for the next couple of hours, did not work, finally decided to come to the hospital, but unfortunately it was too late by the time he came.
So now, obviously not getting into patient specifics, but he's going to be impaired to some degree for the rest of his life?
He is unfortunately completely paralyzed on the left side of his body, and he's in a wheelchair.
Wow. All right. So how do we prevent that? Is there anything that we can do now to prevent us from having a stroke?
Well, there are various things. I think the most prudent, most important thing is awareness and education, because a lot of people do not even realize that they're having it. Unless you know about a problem or have a problem, there's no way to repair it. So the first thing is education. The second aspect of it, there are multiple components. Stroke is unfortunately a multifactorial disease. There are tons of factors that can come together and cause the final event. But in all likelihood, things like hypertension, diabetes, cholesterol problems, once we try to modify all these risk factors, that can go a long way.
All right, so without getting too technical, can you explain biologically what's happening when you're having a stroke?
So essentially, stroke is an irreversible neurological deficit. So what happens is there is a certain part of the brain, just like any other part of the body, the brain needs blood as well. And that blood supply is cut off, and that kind of a stroke is called an ischemic stroke. Of course, there's the other kind of stroke, which is called a hemorrhagic stroke. So among all the strokes, 80% of them are ischemic strokes, which are caused by lack of blood supply to a certain part of the brain, and 20% are hemorrhagic strokes, which actually is a brain bleed. So the ischemic strokes being the more common variants, you typically lose 2 million neurons every minute that you're having a stroke. So that's why time is really of a sense. Time is brain in this scenario.
All right, let's talk about the FAST method and just break them down for us.
Well, FAST is a nice simplified mnemonic that we've created. The whole neuroscience people have created, essentially, which is very good for normal people to have instant recognition of strokes. FAST incorporates face, arm, speech, and time. So if you have any kind of an asymmetry with your face, or facial droop, that's a telltale for stroke. Arm, you essentially ask them to raise both your arms up. If you have a family member whom you're suspecting of having a stroke, have them raise both their arms up. And if we basically start seeing if someone's having a stroke, there's going to be a drift coming down, and this is with a minor stroke. Of course, if there's a bigger stroke, there's no way that you can even raise the arm up. Speech is another telltale sign where you start slurring your speech, and that is a there's a big possibility of having a stroke with that. And finally, time, like I was saying, 2 million neurons every minute, so time is of the essence.
Wow, fascinating, really important stuff for people to know. If they want to contact you, schedule an appointment, see you, how can they get you?
Well, we work off multiple centers. The Advanced Neuroscience Network actually covers all the way from West Palm Beach all the way down to Dade County, Palmetto Hospital in Dade County. And we have numerous entities, so to speak. I mean, our centers are divided into comprehensive stroke center, which offer the highest level of stroke care, and then we have primary stroke centers, which are one level below, but they still deal with most of the important issues with stroke. The comprehensive stroke centers are the centers where we have people who physically can go up, people like me who can go up and pull the clot out. And Florida Medical Center is one of the ones in Broward, is the only one really in Broward from the Tenet enterprise. There are 4 altogether in Broward.
Okay.
Similarly, also we have in Dade County, we have Palmetto. Up north, we have in Palm Beach County, we have St. Mary's, and we have Delray Medical Center.
And the point is, if someone thinks they're having stroke, get to the doctor immediately.
Preferably get to the Comprehensive Stroke Center. You don't want to delay it. I mean, if you're away from a Comprehensive Stroke Center, the good thing is we live in South Florida, where essentially most of these centers are quite close to each other. So, and they offer the highest level of stroke care, so you should really be going to the Comprehensive Stroke Center.
Thank you so much for coming in, Doc, and we appreciate it.
No, absolutely. It's a pleasure having me.
You got it. Thank you, Dr. Kaushal. When we come back, a really cool activity in South Florida, especially if you're looking for a great date night or if you just like trying some great new food. Stick around.